Okay. So Faiza.
Yes. Yes.
Okay. Yes, we listen to you. The
okay,
connection.
fine. Yes, the connection is a bit good. I will try to. Yes. Thank you very much. The connectivity now is a little bit better than. Okay. My presentation is talking about the application of integrated assessment plans and methodology to detect and evaluate arbovirus surveillance in Sudan. The problem and constraints, the results coming up from our experience and practice of the PANDORA-1 in Sudan. Actually, we implement integrated comprehensive surveillance system to detect 3 types of arboviruses which directly related to my study plant in Sudan. Our general vision is strengthening surveillance system for human and animal infectious disease through developing capacity in surveillance detection and early warning system based on new concepts and technologies. The ultimate objective is to develop guidelines and building the national capacity and resilience to vector-borne infectious disease. This is our contributions and our main visions and objectives in this work. And as it had been mentioned earlier, that surveillance is the most important issue not to be considered. And it's endless that when you find the problems and you also gain another types of problems. So we need to be in a continuous work to do and apply the surveillance system in a right way. In general, in Sudan, if we look at the Sudan as a study area, in the past 5 years, decades, have been unprecedented emerging of endemic arbovirus disease, notably dengue, chikungunya, and Rift Valley disease, resulting from the fruit of the modern world, urbanization, globalization, international mobility. As everybody knows that the methods of planning and implementation of surveillance system is very difficult and complicated. And you need to translate all that you learn according to your country policy and according to the strategies and your vision and real situation in your country. Actually, any type of surveillance system binding with specific country regulations based on international regulation and guidelines. Surveillance, as I said, is the complicated work to be done. Before you start to plan or implement any surveillance system, you need to think about the national strategies, country policies, international regulations, and the expected outcome of the surveillance. So we can plan, we can implement, but what is the outcome of what we are doing? Actually, our work here, or the surveillance system in Sudan, I think also in other African countries, we have main key players. Our key players actually implement their work according to adopted international strategies and adopted national guidelines. We have different actors like Ministry of Health, Ministry of Animal Resources, Ministry of Environment, and organizations. So these are the key players and actors of any type of epidemiological surveillance, and also it governs by specific country regulations, ethical guidance, and international regulations. Okay, in this work, we use system thinking, and system thinking actually is a new models to evaluate the integrated work like surveillance or any other types of health work in integrated manners. That means it links all the factors together. It's a little bit different from One Health approach. That means in integrated system, you can use your own thinking and minding issues to answer a specific question. That means the general frame is stable, but you can modify, you can upgrade according to your needs and according to the situations of your country. Here for this work, actually, as I said, this is a part of our work in Pandora Consortium. It is a little complicated work and a combined effort. So we need to collect all issues together to enable us to investigate and evaluate what we are written about in a right manner. Because if we neglect only one individual point, that means you cannot get through the agenda and the achievement of what you want. Actually, here we start with the system assessment. And the system assessment, as you know, it is a very, very complicated issue. Need efforts, need knowledgeable people to do that, and also need a combined methodology and combined strategy. So in our work here, for the evaluations of the implementation of surveillance system, we use many quantitative and qualitative assessment methodology. We use focus group discussion, for example, participatory real appraisal, semi-structured interview, document review, and the most important thing is vulnerability ranking and index. And this is the new modern methodology for the evaluation of or uses quantitative measures to measure vulnerability and risk of implementation of any type of the activity. Actually, all this work has been done, and we start actually, or normally we start with a simple way and up to complicated work in order to get things. So we modified our methodology to include all types of assessment that can be implemented in this work. Okay. In our implemented strategy, as I said, and we started with need assessment. If you want to talk about the reality of the implementation of any type of health policy, you need to think about where are we, from where can we start, and then to detect the gap and problem. Actually, we conduct a policy assessment, a comprehensive policy assessment methodology and plan, and we concentrated in different system assessment and then 3 main types which can answer our main questions. The problem here, the question can be adapted, but how can it be implemented and how it can be set in a right way and in acceptable way in order to answer a specific question. We have gaps, challenges. So actually, if we talk about the improvement, we need to detect the gaps. Where are we? The real situation. And then we can go to the barriers and the efforts for optimization of integrated surveillance plans. And we need to know also the current strengths and weaknesses of zoonotic disease surveillance. If we detect all these 3 plans and strategies, we can get up with valuable information which can help us to evaluate our system and policy. In system assessment, actually, we have qualitative and quantitative measures. It is a methodological issue, a complicated methodological issue, because we need to review all coping strategies and literature to get up with what is the markers and what is the guidance which can guide us for the implementation in a right way. And this is a matter of thinking. This is why we are using system thinking approach. This slide can show us where are we now according to the implemented policy and using of different strategies. You can notice that the functionality of the surveillance is a little bit acceptable because it's under 75%. That means the functionality of human surveillance system in Sudan according to implemented plan is acceptable. This has been done and implemented according to scientific vision of the expert, reviewing of the literature, evaluation of the policy, and using a combined analytical strategies to sort out and to see the real situations. The other thing, reasoning. If we talk about the improvement, surveillance, implementation, we need to go to the reasoning. So implementation of integrated disease surveillance system is a most complicated issue to be done. We need to go through the policy, and all this information coming up from more than 6 evaluation tools, binding with views and thinking of the expert in the area. So we try to package all the implemented policy and methodology together to get up with a quantitative measures which can direct us to a real situations or the real assessment of what we want. Actually, or normally, if we're talking about arbovirus surveillance in vulnerable areas and in complex situations and difficult to reach communities, we need to think about 3 main scientific issues related to patients. If you could not be able to identify the cases and to see and detect, evaluate and implement strong assessment measures for the patients, we cannot get up with a real epidemiological data, and we cannot get up with a real surveillance system to be implemented. So the first thing is chance of focus. We have associations between control of mosquito-borne disease with malaria and Anopheles mosquito. This is the most important issues which can guide us to the reality of the data that had been generated for different epidemiological surveillance, and to link with what our main objectives from this works. Actually, or from the result of this surveillance, we need to strengthen and we need to work in the different control measures of this disease regarding other type of disease. That means if we are talking about arboviruses, ADs, we need to think about other complicated corresponding factors like mosquitoes and malaria, because in Sudan nowadays we have sometimes over or underestimations of epidemiological data related fevers. So we need to think about this if we identify specifically the causations and the nature and the positive factors, so we can plan for epidemiological surveillance. So actually, in mosquito-borne disease, we have problems regarding the surveillance system and the implementation of integrated real strategies. For example, if we have a strategy, a strong strategy regarding the Anopheles mosquito, we need to separate it from that implemented for Aedes. That means this is a very important issue that need to be considered in endemic areas and areas with high prevalence of fevers, because until now, in most of the country, we have no clear adapted guidelines for diagnostic and confirmatory tests for different types of disease related to fever and related to mosquitoes. The other thing is point of care. Point of care is the most important issue, need to be considered for the evaluation of implemented surveillance, which can guide us, allow us to bias in the final epidemiological data and in a bias of the implementation of surveillance strategy in the country. So the most important things which need to be considered as it was come up from the study of quantitative analysis, we need to think about point of care for patients if we plan and if we want to plan for any epidemiological surveillance or different type of epidemiological surveillance. The second thing, adaptations of methodology and standardization, modification and adaptation of applied policy. So this is why we are in a countries we need to think about the adaptation, modification of the methodology. That means we are in different countries, facing different problems, different situations, so we need to adapt and modify the methodology according to our country situations. And this is most important issue need to be considered when we thinking about problems facing the implementation of drugs. The issue of animal surveillance. Actually, we are guided with international policy coming from international organizations like AU, WHO, FAO, and other organizations. But that does not mean that we need to adapt our strategies and policy. We need to modify because we have different situations and different thinking about the specific positions and problems for the implementation of the disease. This is some data regarding the uses of some modified strategies in the assessment of surveillance systems. In this model, we use a vulnerability index and capacity assessment, which is rarely used in the evaluation of surveillance. But if we look to the surveillance system as a combined strategy, we need to think about a combined thinking and how to correlate all variables together in order to get up with a valuable assessment methodology. On this slide, you can see that we range and we grade the expected risk from implementation of surveillance system to different levels and different grades. And this step is very difficult. It is not easy to be done or to be done from books or something like this. You need to think in depth. What is the real important issues that can affect the implementation of surveillance systems among your community? In Sudan, for example, we have very, very complicated issues and complicated factors which can affect positively and negatively in the implementation of surveillance systems. So the qualitative assessment is not enough. We need to combine two or more methodology together to get up with good finding and good assessment methodology. Actually, vulnerability index and capacity assessment can be considered as one of the methodology that can be and maybe or can be used for the evaluation of surveillance system in different countries. We look to the surveillance in this in-depth comprehensive feature because I know or everybody knows that any false epidemiological data in surveillance system can direct us to a false result and it can direct us to false health improvement directions. Actually, for example, you need to consider if we're talking about health system thinking, you need to go through all the capitals or affected things that can affect the implementation and final result of the surveillance. For example, if we're talking about the community movement is a social one, but it is directly related to failure and problems of the implementation of surveillance system. Because in Sudan, for example, community movement, displacement due to different reasons, which can affect the availability of the community in specific environment and situations. And this depends on the level of vulnerability and the seasonality of these events. So actually, sometimes if you are specific seasons, that means you can expect a comprehensive, complicated system to be implemented to do surveillance system. So you need to look to the surveillance system in all pictures and in approach thinking. As I said, it's a system thinking. So sometimes unite financial capital, social capital, technical capital can be considered as the main causes of the failures of surveillance system. But how to do this? It is a complicated, as I said, and it is a combination of different policy and strategy with in-depth thinking. This is another vulnerability assessment models, and here deficiency in the resources. Okay. Surveillance in each country lies with international regulations and national policy and country needs. Sometimes you have well-established and well-planned surveillance systems, but when you go for the implementation, you can find many barriers which can affect the implementation plan and also can affect the reality of the medical data. So the capacity assessment and vulnerability assessment can serve in this issue and can serve some of our problems. Okay, as you see from here, it is a complicated measure. We use more than 8 or 10 methodology to answer specific small questions. But at the end, we have specific thinking and specific findings which can guide us to do in future if we're talking about Pandora-2, to the reality of epidemiological data and surveillance data, which come up from a strong, accurate, standardized assessment methods, treatment policy, application of the guidance, considering of all other factors in order to get up with good surveillance system. We have many or 5 or 6 points need to be considered if we're talking about the problem and constraints, and if we think it about the surveillance as one of our future activities. So the first thing is the co-circulation of multiple EDs, for example, transmitted disease with similar epidemiology, which often result in clinical indistinguishable fibroid syndromes, and here, the diagnostic, the applied, accurate, adapted diagnostic measures, the applications of modified methodology, and modification of our system can be considered as the main factor for the evaluation and assessment of the medical survey. Also, if we use a system thinking approach and talking about a integrated surveillance system. Integrated surveillance system is a mixture between parasites or viruses, other infections, good diagnostic measures, and accurate evaluation and assessment of the patients, and implementation of new ideas. So we need to develop our biological control. So, and we need to differentiate between the control programs for mosquitoes and for ADs. This is the most important issues need to be considered if we're talking about arbovirus surveillance and the reality of the data. The disease transmission are expanded geographically, range to affect public health as a result of urbanization and globalization. Here, we need to consider the socio-economical factors, sometimes political factors, with other related factors to identify our problems and constraints in the implementation of surveillance system. Also, designing general epidemiological design is specifically for hard-to-reach community. And hard-to-reach community has specific features. And we have experiences, specific experience related to this issue according to our experience in Sudan. Application, implementation of normal surveillance system is a little bit difficult sometimes. You need to find new features and to think in a different directions for the implementation of that. So this is why surveillance system is a complicated and need continuous thinking. For example, for our study, we plan, replan, modify, and update our strategy at the same time and the same point of time. You see, sometimes you started with a normal surveillance system among your community, and you find that according to your community structure and socio-economical structures of your community, you cannot implement the surveillance as you think and plan. You need to modify and you need to change your strategy. This is why we actually talk about how to reach the community. Difficult to reach community, which need specific attention in surveillance. Also, the second thing not to be considered, the effectiveness of animal vaccination policy and applications, intervention policy in human and animal vaccines also need to be considered, because implementation of surveillance is a combined strategy and it is in-depth scientific methods. We use actually the scientific finding, but to translate it into policies. That means we need to detect and to go to the policy and to see what is the reality. So the different scientific issues and methodology need to be implemented and need to be raised during our implementation plan. Actually, the common features of this disease or arbovirus disease could stimulate similar research themes. So we are in Pandora-1. I think we are in a phase step. We need to continue and to detect until to get our hands in the real positions which can suit different communities and different regions and different strategies. So environmental determinants, vector control, combining interventions not to be effective against multiple arbovirus disease will offer the most cost-effective and sustainable strategy for the disease. So if you want to talk about the efficacy of the surveillance and detection of the gaps and to be corrected, it's a complicated issue. So I think since we are a consortium and we are a group of scientists with different dimensions working in a different area, so we need to think about this issue. Because all of us, our main objective is to improve the health of the community. If you want to improve the health of the community, you need to detect, evaluate, and assess in the right way in order to get up with the real finding, the root of the problem. So the implementation of surveillance is not the problem. Everybody and every group can do it as it is written in a book. But it needs a specific in-depth thinking. And this is why I recommended that in Pandora-2, we can look in these issues because it consists of the diagnostic, treatment policies, other related factors, which can help community to be cured from different diseases and to help our community in the right way. Thank you very much.